5 minutes for opening statement, please.
Well, thank you, Mr. Chairman. Thanks for all your great work in this subcommittee, that and the members. Again, today we're taking up bipartisan issues that really matter for people's health and the cost of health care. So I think it's another step forward. So I traveled across Oregon over the last 5 weeks, covering 2,000 miles, 39 meetings in 12 counties. You know, these issues come up, especially about health care. The cost, the quality, accessing affordable health care is a real important issue, and it's one we consistently try to tackle in this committee. Today, we hope to build on the bipartisan achievements of the committee under the leadership of Chairman Burgess and Ranking Member Green, and review yet another slate of bills that can help improve our overall health care system. Now, among those we'll examine is the one we've heard about already pertaining to gag clauses, which have been front and center in the national debate on drug prices. Many patients who are struggling to afford costly prescription drug prices may not know that actually paying for their medications with cash is sometimes cheaper than using their health insurance. And with the high deductibles right now, you ought to be informed as a consumer. What's worse is some contracts prohibit pharmacists from telling their customers when this is the case. So banning these so-called gag clauses has gained tremendous bipartisan support, rightly so, with these bills in both the Senate Finance and Senate Help Committees advancing without objection. We'll review the draft legislation banning group health plans offered by employers and individual health plans, as well as Medicare Advantage and Medicare Part D plans, from limiting a pharmacist's ability to inform a consumer about the lower cost out-of-pocket price for their prescription. Now, another practical bill will give the administration additional authority to better detect and stop fraud and abuse in the healthcare system. This has been an area of interest for both the Obama and Trump administrations, and it's supported by the committee's ranking member, Mr. Pallone, as well as myself. I look forward to our continued bipartisan work in this space. We'll also consider 3 bills in the Medicaid space that will help ensure that beneficiaries who are receiving the support and care they deserve in the setting that works best for them. Mr. Guthrie and Ms. Dingell's bill, H.R. 5306, for example, will extend funding for the Money Follows the Person demonstration program, that's MFP demonstration, in Medicaid. The MFP demonstration provides additional resources for state Medicaid programs to help ensure Medicaid patients needing long-term care are served in their communities or in their homes instead of at institutions. By many measures, the MFP demonstration has been successful. We'll also consider a bill authored by Mr. Wahlberg and Mr. Welch, H.R. 3891, that will help improve the authority of state Medicaid fraud control units, or MFCUs. Currently, MFCUs are only allowed to investigate cases of provider fraud and patient abuse in healthcare facilities or board and care facilities. This legislation would broaden that authority so that these units could investigate and prosecute abuse and neglect of Medicaid beneficiaries in non-institutional or other settings. Practically speaking, this bill will improve the ability of MFCUs to help protect vulnerable Medicaid patients from harm while reducing the program's resources diverted by fraud. And finally, we'll consider an amendment in the nature of a substitute to a familiar bill authored by our full committee vice chair, Mr. Barton, and Representative Castor, that's H.R. 3325. Under current law, a health home state plan amendment cannot target by age or be limited to individuals in specific age range. Centers for Medicare and Medicaid Services has reported that states have identified this inability to target health home services as an operational challenge. This bipartisan bill seeks to address that challenge by giving states a new option through the existing health home model to coordinate care for children with medically complex conditions. So, further discussion, this important bill, I'd yield the balance of my time to the full committee vice chair, Mr. Barton, and thank our witnesses for joining us today.